Hi there. So this is a quick PowerPoint presentation on neurological conditions, the neuro exams, and what, as massage therapists, we will see and what we can do in our clinics about these conditions. I saw two case studies of mine that had neurological conditions. The first one here is Ruby. She's a female 14-year-old spayed lab cross. She came to us as the owner was concerned that she was in pain. She had been seen by the vet and he had said that there was nothing wrong with her, nothing that he could see was wrong with her. She was a little bit confused by this, so then was very keen for me to do her as a case study. She had an unusual gait. She was circumdecting her right pelvic limb. She had a wide stance. But apart from that, a generalized osteoarthritis, generalized stiffness, as I could see. And I don't know why, but I decided to do her neurological tests and was completely blown away, really, by what I'd found. I didn't expect to find anything, and this was the first time that I had found something. Even though we see them done just every day at work, this was like, oh, this was quite a moment for me. So when I did her ball placement, she failed that. She failed her hopping and she was sluggish with her withdrawal, which the owner was really interested about, considering that the vet had said that there was nothing much wrong with her. She found it really interesting, and it just shows that the owner is generally right. If they say something is wrong with the dog, then they are generally correct. My second one was Tiger Lily, or just Lily. She's a 10-year-old spayed Cocker Spaniel. And when I did her gait analysis, I could see that she was, or I could hear that she was dragging her feet. I did her neurological tests and found that they were absolutely okay. So it was just purely this dragging her feet, and it was something that the owners hadn't really noticed until I made them aware, and then they were all very aware of it. So to go on to the neurological exams, the first one I'll show you is the paw placement test, where you turn you lift a foot up, you turn the foot over, and you put sort of the wrong side of the foot down on the ground. I show you, so this is Dusty. So you pick the foot up, you turn sort of the top of the foot over and pop it down on the ground, and the dog should immediately replace it in the correct manner. This is actually Ruby. I got her owner to do it because I didn't do it at the time. But you can see she kindly turns the foot over, pops the foot on the ground, and nothing. The dog basically can't feel that the foot's the wrong way up, so it doesn't bother to change the position of it. It's the proprioception is not there. It doesn't understand that the foot is in the wrong place. You see again, even longer with this side, which is quite interesting because when I did it back in November, the right was delayed and the left wasn't too badly delayed, whereas now you can see the left looks more delayed than the right, in my opinion. So I wasn't quite sure what to do with this information, so I asked the neuro lead consultant at Langford what I should do with this information, and he was keen to take referrals for both dogs, but basically said that there was some kind of neuropathy going on there. Ruby, as you can see, is a very elderly dog, and her owner doesn't want any investigations done on her at all. Tom Hugglebrand did say it wasn't catastrophic, so nothing there. My concern was that the disc was going to blow. That was extremely unlikely to happen. So therefore, the owner wouldn't have and didn't want any investigations. With Lily, slightly different in the way that she's a very fit 10-year-old Cocker Spaniel who can walk miles and miles over the hills. And I did casually mention it to the owners, but they weren't keen. I mean, they weren't keen on getting her any joint supplements, let alone paying £300 for a consult and £1,000 for an MRI. So the advice to them was just to monitor. And I'll go into that more details later. This is the second examination. This is called the hopping test. So I'll just run the slide. So you pick one foot up, you sort of overbalance, you get their weight, they have to shift their weight to overbalance them, and they should move the leg that they're standing on, they should move over to compensate so that they don't fall over. I just do it from the second view. As you can see, I pick one leg up, I move her bottom over, and she has to move her leg to compensate for the weight shift. So that's a normal reaction. A dog with neuropathy wouldn't pick that foot up. It would just be like glued to the ground. It would basically just fall over. The third exam is the withdrawal. And with this one, you pick up a limb. It could be any limb, but predominantly it's the hind limb that is the issue. You squeeze in between their toes, and they should pull away from the discomfort. So squeezing between the toes, and Myrtle pulls the foot away and looks at me and says, "What are you doing? That's not very nice." So this is used a lot in neurological testing. It's the very basic ones. As you see the neurological tests that the clinicians do at work, they have got 100 more tests with that they do that can actually pinpoint where the lesion is, where the problem is in the spinal cord, and they have just got they've got loads and loads and loads of tests, which are very complicated and very in depth. But these three are three very simple ones that show whether or not there's a deficit. The clinicians are so good, they as like I say, they can pinpoint where the lesion is, but then they go on and have the backup of the MRI. They wouldn't just go in and operate on a dog off of their physical examination. They would then back it up with an MRI. So just to recap, the paw placement test, you turn the top of the foot over sort of downwards and place it on the floor. In a normal neuro exam, the dog would replace its foot normally, quickly, pop his pads back onto the floor. Any delay in this generally means that there's a neurological disease. There's some neuropathy there. It's the proprioception. It doesn't know that the foot is the wrong way up, so it doesn't make an attempt to replace it the right way up. The hopping test, you pick up one of the dog's legs and change the centre of balance of the leg by leaning the dog over to one side. In a normal test, the dog will just move the weight-bearing leg so that it's still standing up. A dog with a deficit would not move its leg and just leave it where it is, glued to the floor. Again, this is a proprioceptive issue. And the withdrawal test, if you squeeze the dog's skin in between its toes, the dog will pull away from the discomfort. Basically, if the dog doesn't move its leg, then it can't feel it, there's a neurological issue. So what do we do if we see this in clinic? So I must caveat this by saying that this is purely my opinion and my experience from talking to the Tom Harcourt Brown, who is the neurological lead. This is something we discussed So the thing is, if you are concerned about the dog, ultimately, in any way, shape, or form, you should be referring it back to the vet. We know that that's part of our practice. But essentially, if you see something like this in clinic, then don't panic. It's unlikely to be something that you need immediate attention to. I'll go into when you do a bit later on, but essentially don't panic. Explain to the owner that you've done some tests, some neurological tests, and you've found some deficits, something that's not quite right. Although, having said that, this is something that can and does generally happen in elderly dogs anyway. So just say that the messages from the brain aren't getting through to the extremities in the right way. They're being sluggish, or they're not really quite working properly. It's unlikely to be catastrophic. My first thought was that they were going to blow a disc, but that's, I'm told, unlikely to happen. Although it will gradually get worse. That's the thing with this neuropathy, it will gradually get worse, but there's nothing much that they can do about it. If they are concerned at all, then obviously go back to the vet. If they want to get investigated and they decide that's what they want to do, then that's absolutely perfect. That's absolutely right for them. Others will decide that they don't want anything done. They just want to keep an eye on it or whatever. But whatever the owner decides is absolutely fine. But to monitor them and just monitor when they or if they deteriorate. If they deteriorate suddenly, then go to the vet as soon as possible. It's unlikely that will happen, but with any animal and any condition, if they deteriorate suddenly, then they need to go to the vet. It's possible that the spinal cord's being impinged and that needs to be released, but it's unlikely. But what we can do as massage therapists is, one, to communicate with the owner, and two, to make sure it goes on the vet report. So you're clear by saying that you've done some neurological testing, and you can say that you've done the paw placement, the popping test, and the withdrawal test, and you found some abnormalities there. Obviously, you're not diagnosing. You wouldn't say, so I think they've got some neuropathy. But it will make them aware that you have found something there. So other neurological signs and symptoms that we might see and what we should do. So if we see a dog that's off its legs, it's completely paralysed in its back end and it's dragging itself around by its forelimbs, then you have to ask immediately how long the dog has been in this position. If it's just happened or in the last day or so, then it's an emergency and they need to go to the vet and get that investigated. It's likely that they've got an impingement of the spine, as I've said before, and they need an operation. If it's very unlikely that that is going to happen, yeah, that's just, I can't believe a circumstance where that could happen. So if the dog gets off its legs, it's likely that they've had an investigation and they've got a diagnosis, and this is how they have been left. They've had some insult to the spinal cord and they are now paralysed. So you need to ask whether they're deep pain positive or deep pain negative. It's likely that they'll be deep pain negative, because the deep pain positive dogs normally can start to make some effort to walk, because they can feel their back legs and they have got some form of proprioception. And it will lead to the fact that they are ataxic. If they're deep pain negative, then they could be spinal walking. So you need to check with that. And spinal walking is where they don't have any feeling in their back legs, but they are walking off their reflex. It's reflex walking. So they've had really good rehab and they've taught the dog how to walk again, but it's not walking in the same way. The muscles are not firing in the same way. They're just firing off reflexes. And you have to be really careful when you massage these dogs, because they rely on lots of tone in their pelvic limbs. If you massage that away beautifully, then they won't be able to walk, because that's what they rely on. So in those cases, you need to just concentrate on the forelimbs, the shoulder girdle, and their neck. They're basically their areas of overcompensation. Again, if you see a dog in a cart, it's likely that they are deep pain negative, but it's important to check that, and you could check that as well with your neurological testing, with your withdrawal test. But generally, if you see a dog with neurological symptoms, then it's the overcompensating areas that you need to be looking at and paying your most attention to from a massage point of view. There is a really good video that Tom Harcourt Brown did, THB, did with the canine arthritis management. It's just one of their webinars that they did. No, it's a Facebook Live, sorry, that they did. It's really good explaining neuropathy with dogs. It's basically, he was looking at dogs as often misdiagnosed as having arthritis when they've actually got neuropathy. So the vets are giving them loads of analgesia, and it's not working because it won't work on a neuropathic dog. So they can't feel it. So it's something to think about when you have an elderly dog, and it's something that I always do now as part of my palpation for a senior dog. I will do probably a paw placement test, and then see how that goes, and then probably do the other two afterwards if there's a deficit, just to make sure. And it's just one of those extra tools in your tool book, really, to do to give you a better picture, and to really know what you're massaging and where to massage and why you're doing it. Is quite a useful thing to do. So yeah, if you haven't seen that before, have a look at that Facebook Live from that. And I think that's all I have to say on the matter. Thank you for listening.